Thanks, Amanda. The single-shot Johnson & Johnson vaccine is back in circulation in Chicago after it was paused due to the occurrence of rare blood clots in some recipients. This as COVID-19 cases in Illinois and Chicago are declining after the most recent surge. But across the state and country, vaccine administration rates are also falling. So are Chicago and the nation still on track to reach herd immunity? Joining us with the latest is Dr. Allison Arwady, Commissioner of the Chicago Department of Public Health. Dr. Arwady, good to see you as always. Let's start with the J&J vaccine, back online since Saturday. How many sites are you administering the J&J vaccine, and are you hearing anybody refuse to get it because of safety concerns?
Yeah, so really our top goal is to make sure that people have options. We've been careful to label on ZocDoc.com/vaccine which kind of vaccine we're using at City of Chicago sites. Over the weekend, we started using it, for example, at one of our walk-in sites at Kennedy King, and we saw people coming looking for it. We also really are excited about J&J in a lot of our more mobile sites where people maybe didn't start out their day thinking their plan was to get a vaccine, but you put an opportunity in front of folks and they say, yeah, I've been meaning to do that. So we're bringing our Bus back online. We're using it for homebound, and then we're doing a lot more with college students and others. So all kinds of plans, and excited to have a third vaccine back.
So maybe the allure of one shot and you're done helps out a little bit. On-site appointments started on Friday, or walk-ins in Chicago. Does that mean the supply is meeting the demand that anyone can just walk up and they will get a shot?
It is, and I cannot emphasize enough how excited we are about that. Really, for the first time, just last week, we have enough vaccine for anybody who wants a vaccine in Chicago. So we still encourage people to make an appointment. That way we know you have a dose for you. You won't have to wait. You can call 312-746-4835, or you can go online, ZocDoc.com/vaccine, or to your provider or pharmacy. But otherwise, yes, all City of Chicago sites are taking walk-ins. That does include the United Center. And if you have the idea, now's my chance to get a vaccine. See if you can bring someone along with you and take that opportunity.
Because the challenge now is some of the holdouts here. Are you worried that vaccine hesitancy among whichever group of people might cause Chicago not to hit that 70 or 80% threshold for herd immunity?
So we are a little bit ahead of the United States already in terms of our coverage numbers, and we're making good progress every day. I think the main thing that we want to emphasize, and as we shift to there being enough vaccine, this is going to feel more and more like our typical flu shot campaign, where it's not a problem of can you find a flu shot? It's about, do I make the decision to take the time out of my day to protect myself and my community? So we're shifting a lot of our strategies to bring vaccine to people. Think about where you wait, right? The DMV, where you go every day. The grocery store. How can we sort of fit vaccine opportunities into things that Chicagoans are already doing? Because we know there's a lot of people who it's less about I feel hesitant and more just that I need some convenience and I need good access. So we're working on building vaccine confidence, but at the same time, really doing a lot of creative things, I think, related to vaccine access.
And across the country, there are some states and some areas that are lower vaccinated than other, perhaps because of misinformation or just a general feeling that they don't want it. Are you worried that the country as a whole might not hit that herd immunity by the summer?
Yeah, I think it's a concern that everybody in public health is sharing, really, in every community. We need to get a lot of folks vaccinated here to be able to put COVID behind us. And that's just as true in Chicago as it is in downstate Illinois or across the US. So I think, at this point, it's a lot about having the conversations, recognizing it's no problem if you weren't the first to raise your hand. But now there is opportunity. And, we just want to be able to have more fun this summer and put this all behind us, take those masks off. And all of that is dependent on us being able to get a higher proportion, of the city, or in this case, the country, vaccinated.
And this latest mini surge of COVID seems to have leveled off. The city dipped below 5% of positivity rate just today. Are you confident that that surge is peaking and on the other side now?
Yeah, we're certainly feeling much, much better than we were 2 weeks ago, particularly looking at what had happened in Michigan and seeing their hospitals really fill up. So yeah, now that we're coming up on about 14 days of that declining numbers, declining positivity, I think we'll be able to make some more reopening. This is our goal. Keep reopening, and keep getting vaccinated, because the risk at this point is less about how many cases there are in Chicago and more about, are the settings that you are in heavily vaccinated? And if you yourself are fully vaccinated, vaccinated 2 weeks post your second dose, and it's important to get that second dose unless you get J&J, your risk is really relatively low for getting COVID. So it's a new calculus, but yes, I'm feeling confident that we're in a place where we'll be able to do some more reopening, and my hope is to just keep turning that dial toward opening all the way toward the summer.
All right, let's talk about Loretto Hospital. The city now is operating a vaccine clinic out of there after all those reports of off-site vaccinations and improper vaccinations. Are you confident that Loretto has fixed what was going on?
So the reason that we've been working closely with Loretto is that, of course, there's such an important healthcare provider for the Austin community, and that is one of our less vaccinated parts in Chicago. So we really think it's critical that we can build capacity there. We are still on site. There are folks from CDPH who are there every day, and we've been working to make sure that the registrations are appropriate, really working to make sure that the team's fully trained. And it's been a partnership in terms of recognizing that Loretto serves an important role in that community, and we want to rebuild, some of that trust, because in the long-term way, making sure people feel that they can trust their healthcare partner and the place where they get healthcare is critical. So we're pleased to be playing a role in getting that trust rebuilt, and most importantly, getting Austin vaccinated.
Part of rebuilding that trust is understanding exactly what happened, and Loretto put out an audit that didn't really mention how it came to be that the CEO and the COO had connections to some of these off-site vaccination places. What did you learn about that?
So certainly, at the health department level, there's things that we're looking for. We're looking for is all the reporting up to date. We're looking at where vaccines are being administered. I think certainly Loretto has been, quite vocal about the fact that they absolutely did the wrong thing here. Most of their vaccinating was appropriate, but they did let people with connections really jump the line, and they've not tried to hide that, which I appreciated. They've owned it and said, we want to do better, and we're willing to work with the city. Again, my main goal at this point is getting folks vaccinated, and I do think they play a really critical role in that community. So we're working with them and continuing to make sure that they're really totally caught up and everything is absolutely appropriate when it comes to reporting, and working on some of their computer systems and issues to work on some of the structural issues that perhaps made it less easy for them to make sure that all their reporting was completely appropriate and up to date.
That is one of the things it did say in the audit, that they had some problems with their computer systems. All right, Dr. Allison Arwady, thank you for joining us as always.
Thank you.